Heart and circulatory disease is Britain's biggest killer. Over 250,000 people lose their lives to it every year in Britain. There's not just middle-aged men that are affected. Everyone is at risk. Heart disease causes about 40% of all deaths. That's over 245,000 people annually. Every year, 50,000 more women die from heart disease than from cancer.
About 2 years ago I had my first heart attack. I was with friends in a cafe drinking a coffee. Suddenly I felt a slight burning sensation in my chest. And then 2 months ago I had another one. Again, out of the blue. It was a bit more aggressive, this one, than the last one. Walking down the street, just felt suddenly a bit tired. So they rushed me into surgery, and I was gone. I had to defibrillate me, shock me back to life.
Around half of all heart attacks are fatal. If you do survive, your life is unlikely to be the same ever again. You may suffer chronic pain. You'll almost certainly be on medication for the rest of your life. Simple things like walking upstairs will be very difficult. Your heart pumps blood around your body. The muscle contracts about 70 times a minute for the whole of your life. To do this, it needs its own blood supply from the coronary arteries. Fatty deposits can build up in your coronary arteries. Blood clots can block them completely, especially if they're already narrowed by fat. When an artery is blocked, the heart muscle doesn't get the oxygen that it needs. Some of the muscle starts to die. The person has a heart attack. If you're having a heart attack, you'll probably start to sweat. You'll feel lightheaded. Breathing may be harder work than usual. You may feel sick, and you'll almost certainly experience pain in your chest. You can't catch heart disease. It's not normally caused by an infection. What can you do to reduce your risk of having a heart attack?
Lifestyle. Things like smoking, the level of exercise that you do, how much you eat, what you eat, whether you're overweight or not, and of course whether you smoke. And they're probably the principal determinant of whether you're going to run into trouble later in life.
Smoking, heavy drinking, physical inactivity, a high-fat diet and certain kinds of stress are all risk factors for coronary heart disease.
Right, Barry, it's about 2 months.
Barry only drank moderately and he coped well with stress, but he smoked, didn't exercise much and was slightly overweight. These risk factors, plus a family history of coronary heart disease, added up to 2 heart attacks by the time he was 35.
Even when I was having the heart attack, it was like, when they came to me in the hospital and said, look, you're having a heart attack, I was like, don't be stupid. You expect it not to happen to you. You don't expect it.
That we experience people having heart attacks at very young ages. We are seeing increasing numbers of young people in their 30s and 40s and sometimes even 20s with heart attacks.
If you could see the future as a teenager, I might have done things a bit differently and I might have avoided things. It's kind of like I was driving my Mercedes-Benz with no oil in first gear, without a care in the world, and now I've had a major service and they tell me it's okay. But I've still got to take it easy. I've still got to take my pills, and I'm going to be on medication for the rest of my life for sure.
What we've got here is Barry's angiogram, and an angiogram is one of the key tests that heart doctors use when they're investigating heart disease. And looking at this angiogram, which is Barry's taken when he had his heart attack, we can see that here there's an abrupt blockage in his artery, and this picture was taken when Barry's heart attack happened. And you can see that after a balloon treatment has been performed on this artery, the artery is now wide open and blood is flowing normally down it.
The decisions people make about their lifestyles can keep them well or make them ill. In many ways, our health is in our own hands. A decision to go to the gym might do you more good than going to the doctors.
It's much easier to prevent heart disease and stroke than it ever is to cure it. And one of the problems is that people in their teens and 20s and 30s and 40s feel indestructible. So they ignore that, oh, well, it doesn't, that healthy eating message doesn't apply to me, I can smoke and get away with it. And it's this change to sort of abdicating responsibility to the medical profession that concerns me, because what we're trying to do for the big diseases, the diseases that really matter, things like heart disease, stroke, cancer, we want to push responsibility back to the teenagers and say, hey, I'm your advisor, I'm not responsible for your heart, I'll tell you what to do. If you don't decide to follow that information, it's you that's going to be paying the price. I'll still try and help you if you run into trouble, but why not listen to me now and invest in your future?
Exercise not only helps keep the weight down, but it also strengthens your heart. This means it takes less effort for your heart to do its normal job of pumping blood around the body. But it also means that when your heart has to work harder, it has the reserve capacity to help it cope more easily. So John, exercise for the heart, does that mean you've got to be really sweating and really going for it?
No, certainly not. Exercise that elevates the heart doesn't have to be flat out, it doesn't have to be maximal, and you don't need to run yourself or exercise yourself to exhaustion. The general rule is find exercise that reaches a tolerable level of discomfort. It's where you're just sweating a little bit, you're out of breath to a certain extent.
So just maybe a fast-paced walk to school instead of going on the bus?
A brisk walk, climbing stairs quite quickly, not using the lift, running around in the garden, kicking a football with your friends, all those sorts of exercise will get the heart working, because the heart is the body's most important muscle. If you don't look after it and you don't exercise it, then the consequences of that are potentially fatal.
Now people will put blocks in the way and they say, well, I haven't got time, I've got exams, I've got family commitments, I've got jobs that I need to do to earn some cash, there's no time in that for exercise.
You need to make time. You need to make time to look after your body. There are real lifetime benefits from exercising the heart. It can reduce the risk of many potentially life-threatening and dangerous illnesses. And in fact, there's lots of evidence to show that it can also help you live for longer.
If you don't exercise, the consequences can be devastating.
Like Barry Sherman, Carl Dalling had a family history of heart disease, but his lifestyle choices multiplied his risk. He'd smoked since he was a teenager. He had a high-fat diet, and he was physically inactive. Luckily, his heart problem was spotted in time, and surgery prevented a heart attack. But at just 30, Carl has had to transform his lifestyle.
He hasn't been exerting himself, exercising himself, even though he has a young family. His work as an HGV licence holder, heavy goods vehicle, is not conducive to a lot of physical activity. It's more conducive to sitting around, having a sedentary job, in fact. And he's ended up with coronary artery disease.
It does take you by surprise. It's like somebody coming up behind you with a sledgehammer, to be honest. It really does knock you back.
The cholesterol measurements that we took before treatment showed a very high cholesterol, and he himself, on reflection, points out that he's been eating the wrong food.
People who aren't overweight and have a varied diet, that's a diet low in salt and saturated fat, but high in fibre and fruit and veg, are less prone to heart attacks. Sadly though, over half of us are already overweight or obese, and obesity contributes to 30,000 deaths each year in the UK.
The breakfast would have been like sausage and eggs. Dinner then would be something on chips. Then an evening meal, which could have been anything from, I don't know, sausage, eggs, beans and chips or something. I used to drink 3 pints of full-fat milk a day. Also, I do put a pound and a half of cheese in a week, because I was a little bit of a swine for cheese toasties.
There's no doubt that being obese increases the risk of heart disease. The sorts of foods that are bad are those that are rich in animal fats and saturated fats. Fast foods, they're usually rich in salt, and salt with high doses puts the blood pressure up. And even some of the salads that are being peddled in fast food outlets are smothered in high-calorie mayonnaises that increase body weight.
Physical inactivity and a high-fat diet weren't Carl's only risk factors. He'd smoked since he was a teenager.
I suppose if I could do things differently, I would. Smoking being one of them, I would not smoke. Because I see people now that haven't smoked that I was in school with, and to be honest, they just look a lot healthier than what I do.
Nicotine makes your heart beat faster and raises your blood pressure, which puts a strain on your heart. Cigarette smoke also contains carbon monoxide. Now this binds to the hemoglobin in your blood, which means it can't carry oxygen. And when your heart and your other organs are deprived of oxygen, they can't work properly.
Patients with heart attacks at a young age, the vast